Hi guys. Well, that was a mouthful. Thank you. Well, as Rob said, I run this program called Towel Talk. My name is Marco, and Towel Talk is a collaborative program housed at the AIDS Committee of Toronto, and it's a Bathhouse Counselling intervention. And in this presentation, I would like to talk about the intersection between mental health and sexual health in connection to this innovative intervention in bathhouses in Toronto. So basically, what are the program objectives? So as I mentioned, Towel Talk is a bathhouse counseling program, but what does that mean? That means that there's a professional counselor, which is right now me, but we're a team of 2 counselors, and we go to, it used to be 4 bathhouses in Toronto, now there are only 3. Providing psychosocial and mental health intervention for gay, bi, and other MSM who goes to bathhouses. And the program objectives are to provide assessment, professional counseling, and referral services for men in bathhouses. We have to provide an affirming and supportive experience related to sexuality, sexual choices, and sexual identity, and foster the development of a supportive relationship that will help men access services outside. So we have the assumption that a lot of men come to the bathhouse as a way of connecting, not only of having sex, but connecting and finding community and talking to other guys. These men might fall through the cracks, as I am really happy that this presentation is happening right after the survey, because I think this can help us flesh out some of the information that we just had. So we think that there's men that access bathhouses that cannot access certain services because they either don't identify with the services, they do not identify as gay or bi, so some services might not be tailored to them. They might feel very anxious, or also they might not be able to identify if they have issues with certain things. We all are used to think that we can identify the way we feel and we can identify our problems and our difficulties. But as I'm going to talk later on, I've learned through my work in a bathhouse that not necessarily we all can identify and we all know what we're struggling with. Sometimes it's easier not to think about our struggles than actually spend some time dealing with what we have to deal. So this program is developed to access and reach these men in a place where they feel comfortable and safe, where they already go, they can feel anonymous, they can feel confidential, and they can go and have sex. And by the way, now they can talk to someone, which that someone is me. So what are the target populations that we address is men who use drugs and alcohol to have sex, straight identify and or bisexual men who are new to Canada, men from racialized communities, and men who are at risk of contracting HIV and also living with HIV. So this is how it looks like. So that's me in my Towel Talk t-shirt, which says "Wanna Talk." I put this ad on the door, which says "The counselor is in," which is just a bigger and a hairier version of Lucy from Peanuts. And in 4 bathhouses, so some bathhouses provide a regular room, and other bathhouses, like Spike says, which is where the picture was taken, provide a clinic room where I can sit there. These rooms can also be used by outreach worker where they distribute condoms and lube and sexual health information. And I just sit there and hang out. And some men would approach me and start talking to me. And some of these conversations might turn into counseling sessions. Some of them might not. So any conversation that lasts less than 10 minutes, whether I use or not use my counseling skills, is for research purposes is identified as a contact. And any conversation that lasts more than 10 minutes for up to 45 minutes is considered a counseling session. Another thing that I forgot to say that I will say later on is that there's a strong research component and evaluation team attached to the Towel Talk team. So each shift lasts 3 hours, and The model is a single session walk-in model, which means anyone who's in a bathhouse can talk to me as long as they're able to engage in a meaningful conversation for them. So whether they're high, using substances, drunk, as long as they can talk to me, I can talk to them, and it's completely free, and they can access as many times as they want. It's completely anonymous, so I don't ask them their names, and that generates a very specific type of dynamic in the counseling session. And as I said before, sessions can last between 10 to 45 minutes. I also have a sample of the forms that I use in case you guys are interested. If any need is identified, that means someone comes and talks to me. Conversations usually start with, why are you fully dressed? And that might seem like a very simple question to ask, but if we're thinking that I'm in a bathhouse where the context is a highly sexualized environment, where men go there to connect or have sex with other men, seeing someone fully dressed that doesn't work there might be confusing. And more if you're not expecting to find counseling in a bathhouse. So a big chunk of my work is also modeling how you talk to a counselor. So sessions start usually with them asking why I'm fully dressed, or why I'm not having sex, or them hitting on me. And then it translates into finding openings to turn this into a counseling session that is completely anonymous. Once in the session, if there's a need identified for more, I can refer them for up to 8 sessions at the AIDS Committee of Toronto, where I can see them for up to 8 sessions, or I can refer them to any of our community partners. There's a big program advisory committee, and we have streamlined referral services with, basically these are the ones that the evaluation committee found that I've been referring, but we have partnerships with Mount Sinai Hospital, CAMH with the Rainbow Service Hospital, David Kelly Services, Shout Clinic, and we're starting to work on a partnership with the Sherbrooke Health Center, and many other opportunities. So basically anyone who's in our program advisory committee has agreed to have a streamlined referral. So this is helping men who cannot access services or might struggle with wait lists. Now I can support them to go into appropriate services sooner, rather than connecting with me and then falling through the cracks again, because waiting on a wait list might be challenging for some of them. As I mentioned before, there's a program evaluation component, which they were in charge of doing a needs assessment before the program started, talking to outreach volunteers, outreach workers, bathhouse staff, managers, community partners, to see if this was feasible, if actually providing a mental health intervention in a bathhouse was feasible, and if men were going to access it. So far they draw data from the first year of the intervention. So the program started in April 2009, and the data of the first year goes to April 2010. And so that's where some of the numbers are. But overall, to September 27, 2010, we had around 129 shifts, and in those shifts we have 669 contacts, which are, as I mentioned before, conversations that last less than 10 minutes. These conversations might have questions about the program. So what are you doing here? Who are you? Why are you dressed? What's towel talk? What's counseling? Questions about their sexual health. So I have this white thing on my dick. I don't know what is it. And then I can say I'm not a doctor, so I cannot diagnose that. But it sounds to me like you're worried about your sexual health, and then I can refer them to hassle-free clinic. Most of them is hitting on me, so that's also a very interesting way of working in terms of how can I turn someone trying to connect in that way to foster a therapeutic alliance and actually work in something that can be meaningful for them. And how does it, not only me but the other counselor, we translate that sexual dynamic into a therapeutic dynamic. So the first year of data, we have so far these are some of the numbers of who have access Towel Talk. So the majority of men are between the ages of 25 and 55, with some variation between bathhouses. In terms of ethnocultural background, some men who are accessing the service have different ethnocultural background. We feel that Towel Talk is actually reaching men from racialized communities. Here is just contrasting some of the numbers of Towel Talk with the numbers that we have so far from ACT Outreach, which Duncan can speak more about it later. And I want to get to the relationship status, just to, there's some stuff bubbling in my mind after the presentation before. So as you can see, there's men who disclose. We have seen that there's some men in relationships with women, and many whom did not identify as gay or bisexual. 81.5 of the patrons, and again, this is from the first year of the data. This does not count until what we're doing right now. 81.5 of patrons who access the service, or 61 men disclose their relationship status. And this is also very interesting in terms of how it does inform the work that I do. And I found that at the beginning, when I was thinking in binary terms, in terms of how someone identifies their sexual orientation and linking it with the sexual identity, I found that it was more difficult for men to actually settle and talk about the challenges of having sex with men or identifying as gay. As I move away from that and I was able to suspend the identity, meaning that I was not in my mind requesting them to label themselves, they were able to talk about the difficulties of having sex with men, whether they were straight identified or gay identified. So that is something that clinically for me was very interesting. In terms of whether it was open or closed relationships or relationship with same sex or opposite sex, we have the numbers there, and note that relationship with same sex is 58.1 and opposite sex is 41.9. And as I recall, so these are the evaluation numbers. As I recall sessions, I have a lot of sessions with men who are married with women. So we realized that these men, that this program actually extend the services that we already provide in terms of outreach, providing sexual health information. This is a second step in terms of the services that we can provide in a bathhouse. So there's some things that men speak with outreach workers that they're not able to talk to them, and they can talk to a bathhouse counselor because of training or because of the skills that a counselor can bring. The referral patterns can also change. The length of the conversations are very different. So in terms of outreach, conversation might last up to 3 minutes when we have sessions that last up to 45 minutes. And sometimes, a few times I have gone over. And we describe the work that we do very different. In terms of discussion topics of outreach and ACT, these are some of the topics that outreach volunteers and workers describe. And these are some of the themes that I talk to in Bathhouse Counselling sessions. So as you can see, the numbers are relationship issues, guilt and shame. This is usually in connection to the bathhouse. So feeling really uncomfortable in a bathhouse. Or going to a bathhouse and not being able to talk about it with someone else. Then bathhouse issues, so it can be in connection to guilt, or it can also be just what goes on in a bathhouse. Like, this is the first time I'm here, I don't know how men connect, is it normal to have sex with so many men? Then we have loneliness and isolation, HIV/AIDS, homophobia, sexuality, all the way down to health issues, body image issues, psychoeducation, coming out issues, trauma, other STIs, etc. So some of the referrals that happen in outreach are very different than the referrals that I have in terms of for follow-up counseling and mental health and therapeutic services. This program has been very lucky to come with so much support with our Bathhouse partners. Bathhouse managers and community partners have been extremely supportive of the work that I do. They provide a free space where I can sit. So some of these rooms are regular rooms which have a TV on with porn on. And I found that the less I mess with the space, meaning that I don't turn the TV off, I tend to have more counseling sessions than if I try to desexualize the space, turn it off, and pretend that I'm not in a bathhouse. So I am in a bathhouse, I'm surrounded by men having sex, and the expectation might be that they want to have sex with me. So also as a psychotherapist and a counselor, how I'm able to work with boundary crossings so I can turn this into a therapeutic relationship for them. This is some of the, so after a session, if the patron agrees to fill out a feedback form, they fill it out and then they can drop it in a Dropbox or give it back to me. And this is out of that first year, which were 88 sessions, 42 men decided to fill out a feedback form. And this is some of the things that they said. But it was, in terms of the question, it was easy to approach a Bathhouse counselor. The space in which the counseling session, the place felt private. I was able to clearly express my concerns to the counselor. The counselor was skilled and professional. And all of this is just to measure the satisfaction with the counseling session. And again, in the first phase of this pilot program, we were looking for the feasibility. So how many men would access, and if it was okay for men going to a bathhouse to access and talk to the mental health counselor. Now, on the second phase of the program, we're starting to manualize our intervention because basically we're talking to men that a lot of people wanted to talk to, and we're getting data that we were not getting before. So we're talking to men at the right time, in the right moment where they feel safe and part of it. Okay, so these are our community partners. So the program was funded by the AIDS Bureau. The program advisory committee includes all these organizations, which I won't go one by one to not torture you, and it's housed at the AIDS Committee of Toronto. And I wanted to thank Jessica Cateno, which is the manager of programs, program development at ACT, for providing all the data for this presentation, and the program advisory committee and our funders, our community partners and Bathhouse staff, and the AIDS Committee of Toronto. Thank you, guys.